Prostate enlargement or BPH will cover what it is, why it happens, how you might be able to prevent it, the truth about supplements and the various treatment options that are available to you to help manage these symptoms. This is also called benign prostatic hyperplasia. BPH or benign prostatic hyperplasia is an enlargement of the prostate. The prostate is a small golf ball-sized organ located just below the bladder, surrounding the urethra. The urethra is a tube connecting the urinary bladder to the outside of the body. BPH occurs when this gland gets bigger. You may not know this, but it is incredibly common by the age of 60. About 70% of men have BPH by the time you're 60. 7 out of 10 men will suffer from BPH, and by the time you're 80, that number jumps to 80%, but having an enlarged prostate. That doesn't always mean that you're going to have symptoms, and the size of the enlargement doesn't always correlate. Occasionally, you'll get an exam by your doctor, and they'll say, well, your prostate is not that big, but your symptoms are really bothersome. And so, it's more than just the size, but very often it's because there is some degree. Symptoms of an enlargement now. What sort of symptoms are there when you do have symptoms? They're typically related to urination. So here are the things you might see: increased urinary frequency, going to the bathroom more often, more than 8 times a day. Urinary urgency. This sudden and strong desire to urinate that you can't delay. Nocturia, waking up more than 1 time at night to urinate. More than 1 time is considered abnormal. A weak stream, having sort of a less strong, forceful stream compared to what it was like when you were young. Hesitancy, which is essentially a difficulty starting urination, and intermittency, the stopping and starting of your urinary stream. You may also feel what we call incomplete emptying, or feeling like you can't really fully empty your bladder. And sometimes this can also correlate with post-void dribbling, meaning you urinate and you think you're done, and then right afterwards you get a little bit of dribble afterwards. And sometimes you can have leakage. And usually this is leakage because you have to go urgently and can't make it to the bathroom, or sometimes you get leakage because your bladder gets so full that you have what we call overflow incontinence. These symptoms can affect people differently, meaning that some people are really not bothered, but for others, these are really significantly impacting their quality of life, particularly in those patients who wake up at night to urinate. Not only are they at risk for falling on their way to the bathroom, which is very concerning, particularly in older patients, because once you fall and you go to the hospital because of that fall over the next year, your risk of dying goes up to 20%. These falls are really serious. So that's really a big issue. And then secondly, you're not getting good sleep. You're waking up all the time, you're tired, you can't fall back asleep. And this can really affect your quality of life. The other important thing to realize is that BPH is not cancer. Having a large prostate does not mean that you have cancer, and it doesn't increase your risk of prostate cancer. Benign prostatic hyperplasia is not considered a precursor to prostate cancer, and having BPH does not directly increase the risk of developing it. While both conditions are common in aging men and can coexist, they are separate diseases. However, BPH can complicate cancer detection, as both conditions can raise PSA levels. While we are in the middle of the video, if you think this video is useful, click the like button and subscribe to my channel. It is a simple help to me, encouraged to make more videos. Why does BPH occur? BPH or benign prostatic hyperplasia is a complex process, and it can involve issues with hormones, genetics, and inflammation. Hormones do play a significant role, particularly in the prostate. So we know that the size of the prostate is sensitive to DHT, and this is a conversion product of testosterone. So we know that some men who have a large prostate will have higher levels of DHT. But that's not everybody. And we know that it's not just due to testosterone, because testosterone decreases with age. Yet the prostate can still grow. This is where other factors come into play. Inflammation is a big one. Chronic low-grade inflammation in the prostate can promote growth. And this inflammation can be caused by infections, hormonal changes, autoimmune changes, and even changes in the prostate microbiome. When you have inflammation, it triggers growth factors like epidermal growth factor, insulin-like growth factor, and transforming growth factor beta. These stimulate cell growth and division, causing enlargement. Normally, there is a balance between cells growing and dying. But in BPH, more cells are growing than dying, leading to enlargement. The prostate grows. It also creates areas with low oxygen, and this triggers more inflammation, creating a cycle of growth and enlargement. Genetics also plays a role. If you have a close male relative with BPH at a younger age, you may be at higher risk, and symptoms may appear earlier. Increased activity of the sympathetic nervous system can also worsen symptoms by increasing muscle tone in the prostate. How to reduce our risk? We cannot control aging or genetics. But there are things we can do. First, maintain a healthy weight. Men with a BMI over 35 have more than double the risk compared to men under 25. A waist circumference over 40 inches increases risk by about 50%. Stay active. Even light exercise like 2 hours of walking per week can reduce risk by 30%. Regular exercise can reduce risk by up to 50%. Key dietary recommendations for BPH are: eat more vegetables and fruits. Focus on nutrient-dense foods, particularly cruciferous vegetables like broccoli, cabbage, kale, bok choy, and berries, which provide antioxidants that fight inflammation. Prioritize healthy fats. Omega-3s. Replace red meat fats with omega-3 fatty acids, found in fatty fish like salmon, sardines, and trout, or plant sources like walnuts, flax seeds, and chia seeds. Boost lycopene intake. Consume cooked tomatoes to increase lycopene, which supports prostate health. Increase fiber. Foods high in fiber, such as legumes, vegetables, and fruits, can help improve symptoms. Limit dairy and red meat. High consumption of dairy and red meat has been linked to a higher risk of BPH and increased symptoms. Reduce irritants. Minimize intake of caffeine, alcohol, and high-sodium foods, as these can irritate the bladder and worsen urinary symptoms. Hydration. Drink plenty of water throughout the day, but limit liquids in the evening to reduce nighttime waking. Diet limit. High-fat red meat, which increases risk by about 30%. Eat more vegetables. 4 or more servings per day can reduce risk by about 30%. Include foods rich in lycopene, such as cooked tomatoes and watermelon. Manage chronic conditions like diabetes, high blood pressure, and cholesterol. Be mindful of medications. Some antihistamines, decongestants, and certain antidepressants can worsen symptoms. Supplements. Many people ask about supplements. Saw palmetto is the most studied. Early studies were promising, but larger high-quality trials show no significant benefit compared to placebo. Beta-cytosterol is a plant-based nutrient. Phytosterol, structurally similar to cholesterol. It is commonly used to reduce low-density lipoprotein, LDL, or bad cholesterol by limiting its absorption, and to treat benign prostatic hyperplasia, BPH, by improving urinary flow. Beta-cytosterol is a plant-based nutrient. phytosterol. Support prostate health. Found highest in unrefined vegetable oils, nuts, seeds, soybeans, avocados, rice bran oil, corn oil, pecans, walnuts and almonds. Beta-cytosterol has some evidence of improving BPH. Pygium africanum, African cherry or Prunus africana, is an herbal extract commonly used to manage mild to moderate benign prostatic hyperplasia, BPH symptoms. Clinical data indicates it improves urinary flow by 23% and reduces nocturia by 19%, likely via anti-inflammatory actions on the prostate symptoms, but lacks long-term research. Data: Pygium africanum shows some symptom improvement, but studies are short-term. Pumpkin seed extract has mixed results. Stinging nettle is often combined with saw palmetto and may show some benefit. Lycopene from food is preferred over supplements. Supplement quality varies widely and natural does not always mean safe, always. Talk to your doctor before taking supplements. Lifestyle changes can be just as effective. Drink enough fluid. Your urine should be light yellow, not dark, and not completely clear. Avoid bladder irritants such as caffeine, alcohol, citrus, spicy foods, artificial sweeteners, and carbonated drinks. Limit fluids. Before bedtime, treat constipation, as it can worsen symptoms. Lose weight. Even 8% weight loss can improve symptoms. Quit smoking as it irritates the bladder. Medical treatment. If lifestyle changes are not enough, alpha blockers such as tamsulosin and alfuzosin relax the prostate muscles and improve urine flow. Side effects include dizziness and retrograde ejaculation. 5-alpha reductase inhibitors such as finasteride and dutasteride shrink the prostate but may take months to work. They may cause sexual side effects and lower PSA levels. Tadalafil can also help by relaxing smooth muscles and is useful if erectile dysfunction is present. Combination therapy can be more effective in severe cases. Things to learn from this video. There are many options to manage BPH, including lifestyle changes, medications and procedures. SIP. Medications are not effective or not preferred. There are many surgical options available. If you think this video is useful, click the like button and subscribe to my channel. It is a simple help to me encouraged to make more videos. Thanks.